Unfortunately, Arka yesterday couldn't come due to serious reasons, and I propose to replace him slightly because I've seen the slides only once in the train yesterday. So the Finnish Allergy Programme is a wonderful program, and it was published in Allergy, and there was an editorial, and it was written a time for change. And a new day has begun. Really, with the allergy program in Finland, a new day has begun. So, first of all, from guidelines to action programs. There were two programs which were as successful as the other, and there is a third one, the COPD. It started with the Finnish asthma program, which is the most relevant program in the world and which has been replicated, duplicated, and deployed in countries like Chile, in many other, at least in 7 different EU countries and outside. In particular, it was extremely effective in Chile and Brazil. So something which is done in Finland with a very limited genetic background can be deployed across the world. And then Tari Artela, who is a wonderful man, said, well, it's good to control asthma, but what we need to do now is to prevent allergy. And this is the allergy program I'm going to describe. It is, a community problem needs a community solution. And you know, Tari has some words like zero asthma death, but a community problem needs a community solution. It does not need only people in the test tube and people in public health, it needs everyone in the country. Then you need to have key messages of the program which are simple and easily understood. You need to have goals. The goal of the asthma program was to reduce asthma hospitalizations and deaths in the country, and this was shown. Then you need to implement the program, and it is where Arka was so good because he has done numerous hundreds of sessions within Finland in order to teach the program to everyone. You need examples of tools to reach the goals. And finally, you need to ask the question, are we reaching the goals? So why the National Asthma Program was needed in 2008, and it was launched by the Minister of Health, and I was there and I was extremely impressed by what they wanted to do. Allergic disease and asthma are a public health problem in Finland, but everywhere in the world. Strategies until now have not decreased prevalence, burden, and cost of allergic diseases. But the most important way is prevalence, because burden we can reduce it by controlling the disease. However, there is a good outcome in the treatment of asthma, and this was the Asthma Finnish program, and I'm always presenting the same slide. We have to enter a new era. And this is what the Finnish asthma program wanted to do, to enter a new paradigm. We all know that we can control diseases, well or not, but if we stratify the patients, we can. But what we could not do before was to prevent allergy and to prevent the onset of allergy. So this is the strategic planning. First of all, there was a new body of knowledge, and they published a full supplement in allergy, which was the background of that data. Second, they went to national conclusion, and they said, we need to take all stakeholders in the country if we want to be effective. Then they had to have some strategic choices, like practical action plan, like a population and risk group strategy, and qualitative and quantitative goals, as well as early interventions. And then they did guided self-management on prevention focused on smoking and passive smoking. Well, this is essential, but it is not the only one. It's like for prevention of allergy. If you do a single target, like to put mite covers, it doesn't work. If you do the inner asthma program, where you try to get rid of smoking and of all components, then it works. So it is more than smoking, but it is also orientation on public health care and outpatient services, and a critical mass to change. So they set goals and measures, And then activities, which was leadership, legislative, very important. If you don't mobilize the political agenda, you don't do anything. Capacity building, networking, materials and information, improving diagnostics and treatment, and then to know what we're doing. So this was this very ambitious plan, which was started in 2008. So the Finnish asthma program had a different focus. It was on inflammation, early treatment, individual safe-guided treatment, and networking. The Finnish allergy program was prevention and not any longer inflammation, because severity of asthma in Finland has been considerably reduced. Second, tolerance induction. Well, this is, Tari Hartela is very interested to put, for example, a pig in each house, because then you have enough, bad things to prevent allergy. But to put a pig in a house is not very easy, even in Finland. I don't think that they would do it. The quality control of diagnostic work and early recognition and treatment of exacerbation. So you see, this is quite innovative, and in fact it works. This is what is more important. So they support allergy health to reduce the burden. This is the key, support allergy health. The aim is to increase immunologic tolerance, the pig, and change attitudes to support health, instead of medicalizing common and mild allergy symptoms, which is again very clever. And as I said before, a community problem needs community solutions. The key messages: support allergy health, relieve the burden. Again, Tari has very strong words, very simple, which can be understood everywhere and translated in every language. Endorse health, not allergy. And this is what we're trying to do, that is to say, active and healthy aging may be in people with a severe disease. So endorse health. And this is what you're doing at IACI as well. Strengthen tolerance. Adopt a new attitude to allergy. And this is extremely interesting as well, because they reduce the number of children with a diet in schools by a significant number, because too many children are diagnosed food allergy, they have a very restrictive diet without need. Recognize and treat severe allergies early, and improve air quality, and if possible, stop smoking. Well, I think that stop smoking should be put everywhere, because it is so bad. So they have several goals. First of all, to prevent allergy, increase tolerance, improve allergy diagnosis, and the indicators are clear. Prevent allergies, it is the prevalence of allergic disease will be reduced by 20%. This is very difficult to achieve, because the number 20% is small, and also the diagnosis fashions may differ. Increased tolerance to allergens. Avoidance diet to food decreased by 50%, and this has been achieved, not exactly probably by increasing tolerance to the allergen, but by assessing better how food allergy is there. Improve allergy diagnosis. Reduce work-related allergies by 50%. And you know that already in Finland, it's quite low, because they have quite remarkable programs. Reduce by 40% severe allergies and reduced attacks. And be cost-effective, because if you're not cost-effective, a government will never accept your program. So this was the allergy program with Tari, with Erka, and with the lady who is a nurse. I'm sorry, I don't know her well. But this was a multidisciplinary program, which was really excellent. Well, they did it in most regions of Finland, but not all yet. But they did 320 educational meetings. Participants for all levels of healthcare, 19,200. These are massive numbers, if you understand the level of Finland. And so every stakeholder was there, from the politician to the nurse to the patient and to the physician. This is why this program is so good. There are 21 healthcare districts, and there are 14 in the country, but I'm sure that possibly in this part of Finland, well, Susanna may tell me better, but here you don't have too many patients, you have more reindeers. So the educational program of the Finnish allergy was very important again for all healthcare professionals, in maternity clinics, in occupational centers, for students, for everyone. Then you had, this is the key, opinion leaders, National Reimbursement Institute. This is very important, because if there is no political engagement, you don't do anything. And then you did that everywhere, and for the population as well. But this was not to increase the workload, but make a change management. They implemented the allergy program by educational meetings, by FILA. FILA is the Finnish lung organization. It is an NGO, but extremely powerful, with actions everyone in the world, for example, in Kazakhstan. Information of the meeting is agreed with the local healthcare professional, and they are going to do it for 6 to 1 year. The meetings are free, it's during the working hours, and near the healthcare units. Well, this is what they have done. I'm sorry, either I'm going to read it, but you know, it is for the key messages: food allergy, allergy health of population, anaphylaxis, military forces. Well, I didn't know that in Finland they had military forces. School nurses and doctors and nurses, daycare centers, and occupational healthcare professionals. Well, the implementation was also extremely large at, again, all stakeholders levels. And this is something I will read to you, campaign for the lay public since 2011, because the rest, I'm sorry, I'm not ERCA. Well, ladies and gentlemen, I think that also that evidence-based current guidelines for asthma, for food allergy, for atopic dermatitis, for allergen-specific immunotherapy, for smoking cessation, physical training, obesity in children, and obesity in adults. And all of this at a lay public publication, because if you are coming with very complex data or documents, it doesn't work. These are the guidelines for allergy in children. These are the guidelines for medications. This is very interesting because it is the first program showing that there is a reduction in hospital days for COPD. This has never been published before, and I think to me it is the first one. And of course, for asthma, it started in 1981, but look at that. The prevalence of asthma is increasing, the severity of asthma is considerably reducing, and the drug cost is not increasing. So even though you are increasing the drugs, the costs are not increasing. And I think this is excellent, and you will see in the next slide, this is what would have been the predicted cost if nothing had been done. And this is the real cost when the asthma program was implemented. So we can say that an asthma program, although it is very expensive, will be cost effective. And this is a major message you can get. The allergy programs is in 3 steps. The short-term goal is to detect and treat inflammation effectively. Eat early and eat hard. This is again Terry's word. Second midterm goals, the burden is reduced, so you have self-guided management to stop attack on exacerbations proactively. And then long-term goal, which are practical advice to increase immunologic tolerance. This has not been yet demonstrated because the data are not there and it takes longer time. Well, I'm not going to discuss all of the primary prevention, secondary and tertiary prevention. I'm not, again, going to discuss the goals. So, what are the goals yet? First of all, to prevent allergy, well, they don't have the data yet because it's too early. You cannot start a program and get a prevention of the onset of allergy the next day. It takes several years to do that. Second, increased tolerance to allergen in the population. It's going on. Improve allergic diagnosis, yes, this is clear. Reduce work-related allergy. At midterm, 24%, they wanted to reach 50%. Then focus to severe allergy and reduce attacks, yes. And reduce cost of allergy, this is known because we have the yearly cost in Finland. So this is very interesting as well. And these are real-life programs. They are implemented in the entire country. This is why it is so important, and this is why these programs have been used for a long time. So this is, yes. So this is the paper. Unfortunately, and I said that to Tari, this is the only English, because it is a Finnish, and he told me, but you know, we had to publish it in Finnish because we had the support of the government. But I think that this will be published later. So our revisiting of the allergy paradigm has led to actions relevant to society and healthcare as a whole. The midterm program results indicate that the burden of allergy and asthma in the Finnish society has started to decline. Well, I thank Tari, I thank Erkka, Tari to have the concept of the program, Erkka to make it done. And I'm sorry that I had to present it today instead of Erkka. Thank you.